A very good evening to you. Thank you so much for keeping it tuned on Oracle TV. Thank you so much for being together with us kuanzia pale asubuhi mpaka saa hizi, and I hope that which uliweka pale kwa sijaambia kwa diary, this is what I want to accomplish today, you've been able to accomplish it. And now you know it's that time, it's that hour. We are here to get informed. We are here to relearn some things, learn some things, and learn some things. And that is why I make sure I bring you specialists so that they can answer you that burning question, that intense question that we've been having, and relive kwa reality. You know, most of us live in that nitaitaje, kuna fiction, kuna ile mambo yenye tunataka tujiaminie, our own truth, but I bring you the facts on the table so that you do not make that mistake, and also you know what you're supposed to be doing at what time. And if you're told to do 1, 2, 3, why is it important for you to follow that until the end of it? Ukisikia vizuri si ati unawacha sababu unasema jana nilikuwa nasikia weak, but now I am strong, let me leave the medicines. And that is why I make sure I bring you best of the best on this TV, on this platform. Ndio usitafute kwingine. As always we say, we bring you the balance diet meal. Of course, this is the Health Desk, your direct line to your medical doctor, with me, Trevilla Lutta, and today we are in for a good. When I say good, we are in for a good cause. We want to talk about the medication mistakes that most people make without knowing, and others si kupenda kwao, tunataka tu tuwakumbushe. Ni ile maybe unakuwa uko na mambo mingi hapa na pale, and that is why we are here to make you know what you're doing is a mistake and you should rectify it. Maybe umekuwa ukiona kama ni norm, umeona watu wengine wakifanya, umezaliwa ukakuwa ukaona ikifanyika, and you decided let me continue with it, and that is why we are here to tell you stop. This is the way for you to go, and this is how you're supposed to be doing 1, 2, 3. But before I continue, I have a guest. Siko peke yangu, unajua mimi naweza kuambia nitakwambia hizi no, but I bring you somebody who has gone to school, has studied, and the person is also practicing it, is doing it on a daily basis. Akuelezea what are the facts of doing this and this, what is the wrong in doing this and this, and why should you keep on doing 1, 2, 3. But before we dive into it, acha nikaribishe mgeni wangu ajiintroduce, akwambia utampata wapi na napatikananga wapi, siku gani. Unajua kuna wale wako na masiku na masaa utanitafuta hii masaa na nini, so that is why I want to yeye mwenyewe ajiintroduce, akwambia utampata wapi na siku gani. Karibu sana daktari.
Thank you very much, Trevilla, for this opportunity.
Karibu.
My name's Dr.Muraran, a pharmacist by profession. And I have a private practice at Naka Center. My facility is called Vienova Clinic. We offer services from general consultation. We have lab services. We have the pharmacy services. I've worked in the government for over 20 years. So in the pharmacy industry, I am very well conversant. And you're welcome to come to our facility at Naka Center anytime. We are open 24 hours, so we are fully there. We have staff, we have the right medication, we have accurate lab results. Karibuni sana.
Oh, so mtu akikuja anatarajia kupata, are we supposed to get the normal that we find in other hospitals, ama tukikuja kuna specific things that will get there yenye tuwezi pata mahali kwingine?
At the moment, we are very new, by the way. If you've noticed, Nakuru, we have very few hospitals.
Yeah.
There is lack of hospital in Nakuru. There are very few. We are very new. We are expanding. So at the moment, we are doing the basics. But as we grow, we are growing. We want to grow with our clientele. So karibuni, we grow together. I want people to come, we grow together.
Oh, so the services, if you can kindly mention the few services that you can get.
Okay. Now we have, when you come to general consultation, there's physical examination, there's cancer screening, which is very important at the moment. We're doing cancer screening, and then we have contraceptive counseling. When you go to the lab, tukona all the lab equipments, including Zafulim, biochemistry, And the pharmacy is well equipped. Our pharmacy, hautakosa dawa kwa pharmacy yetu. And we have very affordable prices.
Hapo sana.
Nikikwambia I've worked in the pharmacy field for over 20 years, I will not disappoint when it comes to the pharmacy. Our pharmacy is fully equipped, and our prices tutashindana na wale watu wa town, wholesalers.
Wow.
Yes.
Wow. Now you have if you're in Nakuru, make your way pale. Usingoje kuambiwa, make your way. Where exactly are you located?
Naka Center. Ukiwa tu Naka Center. If you ask for Vienova, we are well seen. It is well branded. So if you just ask for Vienova, you'll be directed.
Wow.
Yes.
So ukiwa pale uko Nakuru, please make your way. And if you're in Naka, if you're in these areas of 58, find your way to Vienova and you'll get whatever the doctor is telling you. Go there, get checked, get screened. Tuli agree, fanya ile check-up ikuwe routine. Because nowadays we are living in a world where unalala leo uko hivi kesho, something else in a hit, unasikia sijui, but ukiwa na ile tendency of being checked every now and then, you'll know how well your body is. Kukiwa na kachange kadogo, it will be easy for you to get to understand what is really happening to myself. Lakini kama hujazoea kujiangalia, hata upate nini, you will not know. And we said health is the first key. Trust you me, health. Kama una health mzuri, hata upate mali kiasi gani, you'll never enjoy your wealth. You will never enjoy that wealth. And for us, we want for you to work. Unajua Biblia ilisema kazi ya mkono yako. Unajua kazi ya mkono yako inakubariki, unapata pesa, na also the Bible say you should enjoy. So pale kwa enjoyment ndio health inakujia. For you to enjoy your wealth, make sure you are healthy, get checked. Go there, see the doctor. Daktari pale tukienda atatuambia kama kuna discount. Ukienda atakuwa anakuambia kama utapata discount ukienda usio, kwa sababu you're our family, so lazima akupatie ka discount kidogo. So stay tuned, usikie ni discount gani daktari atakuwa anakupatia. So daktari, to start us off, there's this tendency of people knowing we do not know what is being prescribed medication by a doctor, and also dispensing medicine by a pharmacist. What is the difference?
Now, this is the difference between prescription and dispensing. Kazi ya daktari ni prescribe. You will tell the doctor, you give a history to the doctor. The doctor has, wakienda shule, wanafunzwa. Your history taking, they will be taught how to take that history, and the symptoms, the signs, everything. From that, they gauge what conditions you might be going through. Sometimes they'll send you to the lab. Sometimes they do it clinically. They can see the symptoms and just decide, this one is this condition. That is when they write a prescription for you. Then, dispensing ni pale pharmacy. Pharmacy, sasa ukipeleka your prescription. Dispensing is the act of giving out the medication. And one funny thing, this is how medical school is related.
Okay.
When you're giving the doctor your history, the pharmacist was not there. But when I get your prescription, I'm easily able to know what condition you have.
Oh.
That is how funny it is.
So there's connection between a doctor and a pharmacist.
So sometimes we even have a disconnect when I cannot figure out what the doctor is trying to treat. Hapo ndio unajuanga kuna shida mahali. Lakini nikishika prescription hivi, na si kukua kwa hiyo room, and I know what condition I'm treating, it shows we are flowing in the right direction. So usually prescribing ni kazi ya daktari, dispensing ni kazi ya pharmacist. Yes.
Wow. Now we know the difference. And why is it important for people not to ignore side effects of a medicine?
Side effects of a medicine. Kwanza, side effects especially if you are taking 1 or 2 medications. Kindly ask in the pharmacy, are there any side effects? Should I take with food, after food, before food? Are there any food I should avoid? Those are the questions you should ask. Usually in the pharmacy, we try as much as possible to write them. Lakini sometimes unapatanga workload ni mingi sana, mtu anaandika 1 times 3.
Yeah.
I know that is on us, lakini we are supposed to write 1-3 times a day after every 8 hours, and we say either after food, before food. Yes.
Oh, so it is important to know if you're supposed to be taking this meal before or after.
Yes, exactly. It is some of the active ingredients react with food. Some cannot break down when there is food in the stomach. So we will tell you take it before food. Yes.
For it to work.
For it to work best. But sometimes, kwa sababu sisi hatumesahau kuandika, you will take it, so unakuja after 3 days, you're saying, daktari ile dawa haikufanya kazi, but it is the instructions hapo kwa pharmacy ile ulikosa kidogo. Yes.
And there's this tendency, I've gone to see the doctor has prescribed, the pharmacist has dispensed the medicine. Now I've started taking the medicine, I am feeling better. Kabisa ile nguvu sikuwa nayo, it has started coming back, naona appetite ndio hiyo imerudi. So I stop taking this medicine. What is the danger of that, actually, when it comes also to antibiotics?
Now, and we'll start by saying, to get one molecule of a drug, let's say amoxicillin, the research that is put in that drug, for it to be approved, that it can work for a human being, it takes over 10 years.
Wow.
One drug.
One drug.
It takes over 10 years. Umekuja, umepewa amoxicillin. The pharmacy has dispensed amoxicillin in the right way. You have gone home. After 2 days, you have felt better and you're thinking, why should I finish the 5-day dose? What you're doing is you're exposing the bacteria to the molecule. But you're exposing the weakest bacteria to the molecule in that 2 days. The first thing the molecule does is to attack the weakest bacteria. The strong bacteria are left. What happens? They mutate. They say, oh, this person, this is the antibiotic they'll be exposing us to. So at 2 days,
yes,
it mutates. It becomes stronger. Next time when you come, that amoxicillin will not work. That's why even in November, we had something called the Antimicrobial Resistance Week. We are trying to tell people, if it is not necessary to have an antibiotic, kindly do not have it. And if you're having an antibiotic, kindly finish the dosage. It is as simple as that. Yes, there's no need we risk. Very soon, you'll get admitted for other conditions. Na tumekuexpose. Sasa ulikuja tukakupea amoxicillin, ukakunywa 2 days. So the next time you come, you tell me, daktari, amoxicillin no longer works for me. I'll give you cefuroxime, which is a higher class. You take it for 2 days, you feel better. The next time you come, I'll give you something higher. If by any chance you go to hospital and you're admitted, there is no medication that will work for you because we exposed you to small doses of antibiotics.
Oh, so there's a problem of you taking small portion of it.
Yes, you're creating resistance for yourself. So eventually there's nothing that will be working on your system. Sasa hapo ndio tunaanza kusema,
It's like having a total shutdown on your body.
Yes. So it's usually important. Just finish and stick to may I say, keep it simple. When it comes to antibiotics, the lower you are, the better for you. Usiende hospitali expecting argumenting. Why? Kama kitu simple, Septrin can treat it. Say take Septrin. Yes.
So unajua kuna wale wanapenda, when I see this medicine, I don't feel nimepona. Daktari nikao nipatie dawa mzuri. Na kwa hiyo tendency, there are people who don't, apart from those who don't finish medicine, kuna wale ambao they will miss. See, it is 1 times 3. So nitajiambia siku asubuhi nitoka na haraka when I was going to work. Of course, at lunchtime, I had workload. So I did not take the medicine. So ukifika jioni, since I did not take in the morning and during lunchtime, let me now maliza yote. Let me take 3 at once. What is the danger of that?
That is overdosing yourself. Basically, there is no other way I can tell you. Usually, we say the only time you're allowed to overdose yourself is a start dose. If the doctor sees the infection, the levels of infection in your systems are high, they'll give you either it's called a loading dose. They'll give you maybe 2 tablets start. But going forward, you continue with the same regimen. Sasa wewe, because wewe umedecide kukua daktari wako, you decided you're going to make your own decisions. You decide on day 3, you forgot to swallow lunchtime and in the morning.
Yes.
Trust me, you're doing injustice to your body. You're shutting down. And then our bodies are very funny. You know, they correlate.
Yeah.
The kidneys are the ones which are going to fail the first one because you're loading them. They are the ones that clean our bodies. You're loading them with unnecessary. They'll have to do the cleaning themselves. You're loading. Unajiharibia system for no good reason. Eri hata uweke alarm. Mi usema, put an alarm. Because 3 times hata si mbaya. There are medications that come 4 times. You swallow 4 times in a day. When you find me dispensing such medications,
yes,
I even write the time for the patient there. Unameza isa. I even tell them, eka alarm nikiona.
Ndio sisahau.
Yes, I'd rather alarm ikusumbue, useme, guy, eri you run to the nearest chemist hapo na ununue kamoja. Because you forgot.
Yeah.
And continue in the evening. Than saying, I left the other one at home, I've forgotten this one. Don't worry, I'll go and swallow the 4 of them in the evening.
In the evening. It'll cover up.
Apana, you're spoiling your system. You're damaging your system.
Oh, na kuna wale watu ambao, last time nilikuwa na malaria. I was given medicine. Nikapona. So this time, I'm feeling the same symptoms the last time. So it's either I take the leftover of the last medicine, or rather, my friend tells me, I had that symptom. Na kulingana tu na vile nakuona, pia wewe, chukua tu dawa. What is the danger of that?
Those people are in the same group with the people we call Google medical students. You're graduates from Google and relatives. You graduated, you went to Google, you put your symptoms. Your auntie from Kisumu also suffered the same condition, has told you need dawa. Wewe unakuja hata kwa daktari, hata unamwambia, mimi najua ni nini na suffer from. Na unajua auntie yangu aliniambia, ukinipea hii dawa, this one is the one that is going to work.
Nasema katoni yake ni ya green.
Honestly, there are people who have gone to school. Trust me, these people have gone to school. A minimum of 3 years, what were diploma. Wameenda internship a minimum of 1 year. Lakini wewe, because you do not want to trust that they were taught the right thing, you want to Google or you want to depend on your siblings, your relatives. It doesn't work like that. Wewe tu kuja, trust the medic. Go to your clinician. Go to the pharmacist hapo kwa chemist. Umwambie shida yako ni nini. Without, me I usually say, as a medic, even when I go to the hospital, when I take my kids to the hospital, I don't preempt that I'm a medic. I go and I'm a patient at that time. Mimi unyamaza nasikia niambiwe ni nini. Hata kama unajua mtoto wako anasuffer from what. You don't just go and say, my kid is suffering from this. I think they need this and this and this. No, I usually sit down there, tell them, daktari, this is what's going on, this is what's going on. Ndo niambiwe, acha kunywe hii, acha kunywe. And one funny thing, ukitrust hivyo, your life becomes more smoother. Because they don't do it out of, as a parent, I'm doing it out of sympathy and I'm over-exaggerating it, but the doctor is a bit rational. Anaangalia anasema hapana, sidhani huyu mtoto karibu anaenda kweli. Pengine tu ni kahoma, pengine ni kahii. Maybe hata he doesn't need an antibiotic. That's why I'm saying, let's trust our medics. They have gone to school, they have studied. Let's just trust them.
Utuweke imani
hapo more trust too.
Because tuliambiwa kila mtu aliyeko, kwa sababu sisi wote tungekuwa madaktari. Sisi wote, that's why they are there. Na kuna hao wenye wako na tendency ya they are mixing painkiller. Anaona painkiller inside. Wacha niende herbal medicine, anachukua herbal medicine kidogo, anaka supplements. This person is mixing in a span of them maybe going to the doctor and being prescribed the right medicine. They still go to the herbal medicine. They still actually diagnose themselves also. Pia wanajiongezea madawa. What is the risk, danger of them doing this? And of course, what worries you the most in this case?
and I would say toxicity. But let me start by saying, wow, naitwanga combination scientists. Hao ni watu wako, hao ni combination wanajua mwarubaini ukimix na hii na hii na hii. Let me now be honest. Herbal remedies work. They do. But the problem is when you mix it with pharmaceutical remedies. Pharmaceutical remedies also work. But, you know, most of the time we don't know the strength of these herbal remedies. So, hata ukikuja kuniambia and you're doing a herbal remedy, the first thing I'll tell you is give yourself, stop doing that herbal remedy and give yourself time before you start doing the pharmaceutical remedies. Because the toxicity levels that can happen there, tunaweza kushindwa kureverse because it is very toxic. What I would tell people is, when you go to a doctor and you've been doing herbal, be honest. Mwambie daktari, mimi nakunywanga mwarubaini ama nakunywanga dawa. In fact, hata kuna watu wanaekanga some things, some other funny things. Be honest and tell the doctor. That way, chances of us intoxicating you will be less. Because we'll have to give time for that, whatever you've been taking, to leave the system before we start ours. But most patients, because unaaibika kwenda kuambia daktari ulikuwa umeleta 5 liters kutoka Mogotio ya kukuja kukunywa, unanyamaza, sisi tunakuongezea zetu, inaenda inaharibu the whole system, tunashindwa kwani huyu patient what happened. Munaangalia prognosis hivi, mnashangaa huyu alifika aje hapa.
Kuna wale ambao wanaogopa maybe the doctor will talk to them rudely.
No. Okay, I know we are a bit harsh. We are a bit harsh, but lazima tuchape kiboko mmoja mbili tukwambia stop it first. And then come now and we clean the system, and then I come for the pharmaceutical remedies.
So what you're saying is important for you to tell, when you're going to the doctor or to the pharmacist, just be open and honest.
Be honest.
I've been taking this medicine for 5 months, but I'm not seeing any change. And that is why I've opted to come here.
Yes.
So that you can verify for them what and what they're supposed to be doing. And maybe in that case, the instruction that you give, when you're giving a person medicine or prescribing, the instruction you give, and those instructions may seem small. Actually, zinakaa kama ni kadogo tu. You 1 times 2. Yeah. Zinakaa kidogo kabisa. But now, what are these risk of us not following those instructions, or how important are they medically?
Now, those instructions, you know, the way I think I think it should be abolished. You kuandika 1 times 3.
Or are these instructions even more important?
They are very important. Because I think we should, maybe we write in words or everything, people will take it seriously. Take 1 tablet after every 8 hours. Maybe you will take it more seriously. Because if we write 1 times 3, people, you'll take time first. You will take time to get better. Because you're taking it the way you want.
Yeah.
One, I've talked about exposing yourself to minimum levels of the active ingredients. It doesn't work well for you. Sisi tunataka tukigonga hiyo sickness, tuigonge mara moja tuimalize. We move on to other things. Unapata umedelay hapo, tunashangaa kwani huyu si alikuwa hapa last week. You know, there are those patients, I'm sorry to say this.
Unaona sema tena.
Guy. Kwanza unamwambia kwani dawa haikufanya. Unaanza kujishuku.
Kama ulimpea right.
Unamuuliza guy, kwani dawa haikufanya kazi? Because you're thinking, I gave the right drug, I gave the right dosage, everything, you wrote the instructions well. Kumbe ni patient ya ameenda akafanya vitu zake, ya na meza vile anajisikia. So, kindly, hiyo 1 times 3 is very important. Acha tutaongeza hours hapo ya kuskip. I think I'll start a campaign. Watu wa pharmacy, tafadhali, can we put it, everything, we put it in wording?
It is important. I would try at least to pay leakage. Yeah, how many hours are we supposed, because tuandikiwangwa tu 1 times 3, 1 times 4. Sasa si wenyewe tunajikalkuletia masaa, unajiambia nimekunywa saa 4, ingine nipige masaa hivi saa 7 hapo.
Sasa 1 times 3 inakuanga ama 2 times 3 is 2 tablets after every 8 hours. So mi huambia patient, ukiamka asubuhi, if you do it at 7, 8 hours itakuwa saa 9. And then the other one is just before you go to bed at around 10 or 11. That is how it's supposed to be.
Okay.
Lakini sisi 1 times 3 yetu ni saa moja asubuhi, saa 6. Na around 6. Tumemaliza hiyo story. So that's why usually most of the time by the time uandika hours hapo chini, it's usually good. 1 times 2 is every 12 hours. So if it's 7 in the morning until 7 in the evening. Okay. 1 times 1 is straightforward. 7 in the evening, and also keep time. Si atu unameza 7, alafu kesho unameza 9, kama ni 1 times 1. It doesn't work like that. If it's 7 in the evening, kindly give it a plus minus 30 minutes.
Okay.
Yes.
At least now you know. It is 8 hours, and then timings are very important. Make sure you keep the time.
Yes.
Because if you skip the time, what will happen?
Your system, now, if I swallowed today at 7 p.m. and then tomorrow I forget until around 10, my system would have told itself, no more drugs.
No more drugs.
So I start again like it's a fresh dose. Nilikuwa nimesha sahau. Lakini we need it to be a continuous treatment. That's why we say keep the time.
Okay.
Yes.
And let us try to keep the time. Hatuombi watu wakuwa wagonjwa, but kama umekuwa hapo, please try and keep the time. And there are these people who keep medicine. Personally, I have an auntie. Ako na store ya dawa. Ukikuma na kitu anakuambia, kuna Panadol pale, enda uchukue. What are the dangers of storing medicine?
The first one I'll say is, top of my head, expiry date. Do we even check the expiry dates of these drugs once we store them in our cabinets? Me, I'm a pharmacist and I don't have drugs in my house.
Wow.
I don't. Naiza gonjeka mpaka nipige simu niseme, woi akisimu nilete painkiller. I am a pharmacist. I work with drugs daily. Because chances are, kwanza tunapenda kuzieka juu ya fridge.
Yeah.
We will forget those medication. Even for 6 months, even for 2 years. If God gives you health, you will forget those medication. Mpaka ile siku utaumwa na kichwa, and then you remember kuna kuwa na dawa juu ya fridge. I say, let's use drugs when necessary. See, you're not trying to sell the drugs. Okay, it's allowed for parents who their kids are still very young. Kuna age yenye, and you need painkillers in the house. Lakini kuna age ikifika, you don't need the drugs in the house.
And maybe what are the dangers of using expiry drugs? Zishapita expiry date.
Ikishapita expiry date, that's a poison already.
Wow.
That's a poison. It's no longer a drug, it's a poison.
Sini siku tu mbili zimepita.
Poison. Hiyo ishakuwa poison already. That's why hizo dates zinaekonga. Otherwise, tungepewa dawa tu free. There would be no expiry dates. They would just be telling us, sawa, you guys kunyweni dawa vile mnajisikia, lakini hiyo expiry date is very important, because once it pisses there, that it starts now disintegrating into something else. The active ingredients now start changing into something else. It becomes a poison to us.
Oh, so what was supposed to be that medicine to be doing?
It starts breaking down. Kama ilikuwa OH inaanza kwenda H, ama inaanza kuleta kitu ingine hivyo.
Wow. And maybe have you ever been in a case where it was just a medicational mistake that somebody has done, which has led to a serious complication? Umekutana na kesi kama hiyo? Kuta mtu huyu ni venye aliamua kufanya mistake, ndio maana ako hapa. Have you ever find such a case?
Most of those conditions are usually comes with these people who have an chronic condition like diabetes or hypertension. Mtu amepewa dawa vizuri, and then you decide, umepima sukari yako ama pressure yako, it's aziko juu tena, you stop taking. Unfortunately, I lost one of my clients like that.
Wow.
Alikuja, akasema yeye alidecide, sasa atakuwa na meza dawa tena, because they're keeping fit, they're exercising, their pressure is okay. That was on a Thursday. By Sunday, he was gone.
Wow. That's within that short time?
Yes.
Okay, what should viewers learn from that?
Take your prescription medication the way you're prescribed. The doctor is the one who's supposed to stop the medication for you. you don't, acha daktari mwenyewe akuambie sawa, we've monitored your pressure or your blood sugars for the last 3 months or 6 months, they've been stable. Now, and then you don't just stop. Unfortunately, we don't just stop these medications up. We tone down.
Oh, there's a process of stopping it.
So maybe for 1 month, we tell you, if you are taking it twice daily, we tell you, do once daily, we monitor. And then do half a tablet, we monitor. That's how we stop the medication. We don't just wake up one day and decide, my client has been okay for the last 2 months, but we stop the medication. Trust me, it won't end in... it will end badly. Yes.
And tumongelea wale watu wanachukua dawa mingi. What is the dangers of somebody taking less prescribed medicine? Tumwambia uchukue 1 times 3, ukajiambia 1 times 1 iko tu sawa na mwili yangu. Bila najiangalia huyo daktari anataka kunimaliza. Let me just take 1 times 1 and we continue.
And hiyo tu, you will expose yourself. Low dosage. Low dosing also. Most people don't know the dangers of low dosing. Low dosing itakuharibu kabisa. You're exposing yourself to tiny pieces of your... Kwanza utapona. What are the chances utapona? Utapona. Ni hiyo tu, you're exposing the weak bacteria, the weak infection to the medication. So you will feel better. You will stop sneezing, you will stop having a runny nose, but in reality, there is nothing you've done. Yes.
And most people prefer OTC medicines and they think it is the best. Is that true?
No, self-diagnosis. Wewe ushakuja, wewe unajua dawa yako. No, just go and see the doctor. Okay, me, I tend to... Kila mtu alisomea, as in, all of us could not be doctors.
Yeah.
But there's a reason why doctors are there. There's a reason why our clinicians are there. Let's just go and see our clinicians. Give them your symptoms. Let them be the judge. In case of anything, even you'll have a backup plan. Akikupea, unajua kesho unaweza kuja kupiga kelele useme daktari nilimeza dawa vile uliniambia hivi. Hapo ndio unapewanga sasa free consultation, unapewa sasa VIP. Ukionekana hospitali watu wanasema, "Why ndio ule client?" Yes.
Mwanawachapa pesa mingi.
Yes. Lakini hiyo over OTC, apparently OTC, you'll eventually use more money over the counter than going to see a clinician. Because you'll come after every 2 days. Because it is you who has come and said, mimi nataka Brufen na Cetirizine. They will go. After 3 days, you come back, you say, hata sijapona, lakini unipe Cetirizine na cough syrup. Upewe. Ukuje tena useme, unajua nilimaliza ile Brufen nipe, sijui what. Eventually, if you had gone to see the doctor would have given you a comprehensive prescription that would have covered all your symptoms and treat you in one go. But now you come to the chemist after every 3-4 days for the same condition. You're spending more money than what you would have spent.
Yeah.
Yes.
I mean, what are the common mistakes that caregivers do when they're giving medicine to children? Jo, uko hapo umewachia mtoto, mama akwambia ndio dawa yake hapo. And they are gone.
One is overdosing the kids. Caregivers, me I tend to think, tunafaa pia kuwafunza, tukisema 5 meals. Anapima hiyo 5 meals na nini?
Macho.
Atashika ile kijiko kubwa ya kukula ile kubwa. Na aweke. Naambia mtoto kunywa. Azin, umemwambia utampea kijiko moja mara 3 kwa siku. Wewe umemwambia ni kijiko gani?
Hujamwambia, by the way, hujamuonyesha.
Hata ukimwachia hiyo top ya dawa. Umemwonyesha ukamwambia 5 meals ni hapa. Ama you are assuming anajua 5 meals ni nini. So unapatanga, most of the time they overdose our kids. Unapata ulipea pirito mtoto amelala the whole day. Ni kwa sababu alipewa kijiko moja asubuhi, saa 7 akapewa kijiko ingine, jioni
anapewa kijiko ingine.
Anaambia mama yake hata mtoto leo amekuwa mzuri amelala the whole day. Kumbe ni overdosing, ameoverdosiwa.
Leo hajanisumbua.
Leo hata hajanisumbua. Kumbe ni overdosing. The baby is overdosed. Very well. So kindly let's also teach our caregivers the right dosing. Don't assume they know. Even if they, sometimes kuna caregivers kirehere, they look like they know it. No. Me, I usually say, just make sure you tell them
You
also.
tell them, yeah.
Just back up. Na umwambie 5 meals ni hapa. And keep on also reminding them, umempea mtoto, amereact aje? Because sometimes the babies react to these drugs and they'll just keep quiet. Anacheza. Amelala for how long? Those are the things you should follow up. You don't just give them and then you leave them with the babies like that. No. Yes.
Nowadays we find people, we have so many groups. We're in the era of technology. We have so many groups. We have so many WhatsApp groups. Tuko na social media, tuko na Google. What are the dangers of us getting advice? Niko na watu kama 6. Kuna mwenye anakaribia kuwa daktari. Kuna daktari mwenye ameniambia. Na kuna hao wengine. What is the dangers of us taking those advice? And unoko serious kabisa. You're like, nani aliniambia hii? Nakuja kwako unaniambia hii na kani nimechanganyikiwa. Narudi tena natoka kwako naenda kwa another person. And then also I find in the group saying something else. What are the dangers of that?
And to answer that, I'll give you a small story, a short story about one of my clients. There's this herbal medication for family planning. So she goes, group yake wakamwambia, hey, mimi natumianga, and it is once in a month. Unameza moja, na hiyo story unambaka hiyo next month, a time like that. This client swallowed 1 tablet. Aliadmitiwa.
Wakati alimeza tu hiyo moja?
Hiyo moja, the next day alikuwa hosi.
Wow.
Pressure ilienda juu, kichwa ilimuuma continuously. And then you are afraid to tell your husband what you have swallowed. Unaleta hospitali pia, you don't want to open up because you will be told what is that. Because in the hospitals, we don't know. You know, these herbal things, the unfortunate part about this herbal thing is we don't know the active ingredients.
Yeah.
We don't know their mode of action. So it is very hard for us to even remove it from your system. That client for the whole month was in hospital daily just because of 1 tablet that was advised by friends. What I would tell you is, advice ni daktari anako advice. We say we do nutritional guidance, we do contraceptive counseling. Hizo ni makazi za daktari. Si za marafiki wako. What works for your friend might not work for you.
Bodies are different.
Bodies are different. So your advice, wewe achana tu, achia daktari wako.
Usione inamfanyia vizuri unajiambia, kama yeye mwili yake iko hivyo hata mimi.
Para. You'll get shocked.
Wow.
It will cost you more than you can think about.
Unajua health yako. That is why tunakwambia it's very important for you to be, before you make any decision, hata kama umeona by the way it is promising because it is working for them, just go to your doctor and let them examine you and give you what works best for you. Because we have different body types, we have different genes. Maybe gene yake inakubali hiyo dawa. Wewe yako, it will fight, it will be against it. And that is why I'll keep on reminding you. If you're in Nakuru, by the way, and this environment, make sure that you go to via Nova to get checked. Enda pale ukaangaliwe, ukapigwe scan yako safi. Make sure, kwa saizi cancer it's rampant by the way. So make sure you get your screening. Go there, do that normal checkups. Let them look at you, let them know what is happening to your body system, and they'll advise you accordingly. These are qualified. When I say qualified and certified, the importance ni pale kwa kuwa certified, because kuna wenye wako qualified lakini hajakuwa certified. So this is certified. When you go there, you know that your health is best. It will be itakuwa itaangaliwa vizuri na wenye wako pale watakutreat vizuri na heshima. So you go there, get checked, fanye, na tumekubaliana daktari amesema atawapatia ka discount. Atawapatia discount. So kama uko hiyo maeneo, please make sure pia you drag your friend along and make sure pia yeye ameenda ku get checked. Nimesema drag your friend along, kakumbuka. There was a time we went through. Tulitoka tu kwa nyumba tukajiambia let us go get checked. Now the problem ilikuja wakati mwenye tulienda naye alikuwa wa kwanza kuwa checked. So what followed? Tumeenda tukitembea, tukaambiwa kwanza yake ni emergency case. Alienda ward direct. Mimi kona hivyo nikamwambia daktari mimi niko sawa. Daktari, I am okay. Lakini usishikwe na hiyo uoga nilikuwa nayo hiyo siku. but coming next day at least I got checked and I was okay. So that is why I told you, unaona tulienda hospitali tukitembea but nilimwacha akiwa ward. So make sure you go get checked, ndio kama kuna zile vitu zinaweza kuzuiwa mapema ziweze kuzuiwa. Unajua saa zingine mambo mengine tunakaanga nayo, tunaacha wakati imefika ile stage ya mwisho inataka kulipuka. That is when unasema this migraine I cannot take it anymore. But kumbe ni kitu yenye ungeanza kuwa checked kila wakati, ungeweza kujua what is happening to your body. Pia ukiwa na headache yenye iko consistent, usijiambie tu mimi acha tuende nikatafute tu pale Panadol nikatafute mara moja. Enda uangalie, inaweza kuwa si kichwa tu, ni something else that is triggering that headache. You go get checked, tuambiwe this is just umechoka, lala. But utakuwa umejua hakuna kitu ingine yenye nafanya hiyo, because I understand daktari kuna vitu mingi that lead somebody to have headache. Si ni ukweli? So ukijiambia unameza dawa itawacha kichwa, itawacha kuuma, lakini ugonjwa itazidi kulipuka. And that is why I'll keep on advocating. Make sure you go get checked. And if you're in Nakuru, uko pale Naka, uko 58, uko free area, wako tu kwa barabara. Daktari tukumbushe watu wako utawapata wapi? Ndio mtu aseme nilisahau direction.
So mkiwa Nakuru, you come to Naka Center. Hapo Naka Center, we are well labeled, well branded. We are Nova Clinic, and we have packages. We have wellness packages, by the way. We have for 14 years and above, both male and female. We have wellness packages. You come, we do for you around 5 tests. The doctor checks if you need any medication, sawa. If you don't need any medication, well and good. But karibuni sana. We come and check. We partner together in this health journey. Yes.
And it will be very important for you. Your health is very important.
Yes.
Your health is number one priority. Usidanganywe na mtu. Unaona afya yako ndio itakufanya uende kila mahali unataka kwenda. Wala watu wanasema I want to go to Dubai. Before you fly to Dubai during this festive season, make sure you've gone to get checked. Daktari tukimalizia, there's this tablet that people crush. Unapoa dawa, unaenda unajiambia, mimi kulingana na mimi tablet, let me crush it. Ndio tumalizane tu haraka. Hii system sitaki mambo mingi. Is that dangerous?
Yes, it is. Most drugs that, okay, if it is supposed to be crushed, inaandikwango hapo kwa packaging, chewable. If it is not written chewable, it is not supposed to be crushed.
Wow.
Ama imeandikwa dispersible. Dispersible, that means you put the tablet in the water and then it disperses, you drink it. Lakini kama haijaandikwa hivyo, tafadhali tujifunze. Unaona vile unaweza meza githeri? Haijai kukunyonga, hata dawa hizi kukunyonga. Imagine hizi kukunyonga, hata ugali unakulaga a big piece. Imagine those dawas just go. They do go. Pia storage, nilikuwa nimesahau kuongea juu ya storage. Ulikuwa umeongea juu ya caregivers. Caregivers also, we should tell them where to store the drugs.
Yeah.
Si hapo kitchen karibu na gas ama karibu sijui na wapi. Na saa hizo ni hii ya watoto. Most of the time tunawachia hii ya watoto. So tafadhali, storage of the drug, we make sure we store them. If it is a cool place, let's store them in a cool place. Kwa sababu if you put it somewhere that is warm, it starts turning into something else. That's why when they're in the pharmacy, they come in a powder form.
Yeah.
They're not stable. That's why we mix them for you in the pharmacy and tell you store it in a cool place. Because that molecule is not stable. So, tukikwambia eka kwa fridge. Na kama una fridge, look for somewhere that is cool, hata kwa floor. Put it down somewhere in the floor, penye ni baridi. That one will be, ama ndani ya maji hata. That one will be okay, yes.
Wow. Now, can medicine be taken with tea, coffee, milk?
No. Water, swallow with water. Maji ni muhimu. Maji ni uhai. Swallow with water. Yes.
Na ukiambiwa once daily. Once daily, what does it really mean? Because
once daily inamaanisha, once daily ni ile ya 24 hours. Si once daily ati ulimeza saizi asubuhi alafu kesho asubuhi kwa sababu ni siku nyingine udecide acha nimeze tena asubuhi. No. Once daily means after every 24 hours.
On the same as 1 times 1.
Yes.
Ni kizungu daktari mnatuchanganyanga nayo.
Once daily is after every 24 hours. Yes.
Now we know. At least when you're told once daily or 1 times 1, you know it means one and the same thing.
Yes.
If I'm not wrong. And of course, make sure that I'll keep on reminding you. Don't prescribe medicine for yourself. Don't go and say, you know, mimi napenda tu nikae na madawa kwangu. Nisipoona madawa sisikii mwili ikiwa sawa. What if you just start now? At least we've finished this year. At least start that katabia ya kusema, what if I don't stay with this medicine? I start speaking good for your health. Unajua mara mingi ni whatever you believe, it happens to you. And whatever you confess, if you confess sickness, trust you me, utawahi toka hospitali. Utashindanga ukienda in and out. And I believe daktari si raha yao kuona wagonjwa kila wakati. Wakuja unani, but once you have health, please make sure uko pale kila wakati. Kwenda kuchekiwa imanishi unaenda kuchekiwa sababu there is always something wrong. Hapana. It's just knowing your status. How are you being? How are you faring on? Ni nini unafaa kufanya zaidi? Maybe unakuta kuna vile. Nikisema hivyo nimekumbuka. Kuna wale watu wenye siku hizi tumezoea. We want firm skin. We want to have a glowing skin. We want to know, and now we are in the way of not taking food. We want supplements. We want to take more vitamins prescribed by ourselves. And of course, unajua collagen ndo mzuri. We take our collagen supplements. And we don't know. Daktari umeniangalia baka.
I'm waiting for you to finish.
Tunataka hizo because we want sharp results. What is the danger of that? Because sasa siku hizi si chakula normal. Nowadays we are in supplements.
There's no microwaving health. There's no microwaving health. Ati unataka haraka. What are you supplementing? Umeenda hospitali ukapima ukakosa hiyo, whatever you're supplementing. If you've not gone to the hospital and you've been told your body lacks collagen, why are you taking collagen? Your body is able to regenerate collagen for itself. Me, I usually say supplements are for some ages. Kuna ages ukifika, the doctor will even tell you supplement your calcium, supplement your collagen, supplements. Lakini unatupata in our 20s, our 30s, we are doing why are you doing collagen? Alafu sasa siku ile utazeeka, what will happen? Your body would have become weak by itself. You know, it's good. Unaona mtoto akipractice. The more practice makes perfect.
Yeah.
But if you're supplementing something the body can already generate, that means you're telling your body, stop producing it, let me supplement it. Na tuko na machakula zinatupea hizi ma collagen. Tuko na chakula inatupea hizi ma calcium. Tuko na chakula inatupea hizi ma vitamin D. Why don't we eat those food? What is so difficult in eating? Supplements munanunua 6,000. Chakula hapa, wewe ukienda hapa omena ni how much? Samaki ni how much? Yes.
It's just simple.
Yes.
Tunataka kupika. You know, nowadays the kitchen, it's too much work.
Kitchen ni muhimu pia. In pharmaceutical world, the kitchen is very important. Because if you eat healthy, chances are you'll not go to hospital.
So everything starts in the kitchen.
It's our diet. Our diet comes first. Even most of the conditions we are having these days is because we are too busy to go to the kitchen and cook it ourselves. So we end up ordering in. Kazi tuni, I'm late from work. Let me call. You're just kazi ni ku order in. You're just ordering in. You ordered in on Monday. You ordered in on Wednesday. You ordered in on Friday. Saturday you went out. So we are not eating our authentic foods. That's why ukipata wazee wa kitambo. Imagine they are healthier than us.
True.
They are stronger than us. Those people still go to the shamba. Wewe ukiambiwa uende shamba leo.
Jembe ni kazi.
Yes.
Kuinua jembe si mchezo.
So kindly tukule. Instead ya kusupplement, let's look for the food that give us these supplements.
Wow. So those people who are supplementing, it is not good unless you are prescribed by the doctor. Na I believe una prescribe kwa sababu kuna something your body imekosa.
Yes.
That is why they are boosting. Si kumaanisha ati uache kukula, wanakusaidia hiyo ndio isaidie kuboost. Ikifika a certain period of time wakati uko sawa, they will stop you from it. So make sure that haujajinini mwenyewe, haujajiwekea hapo mwenyewe. And of course remember these This is the Healthdesk with me, Trevilla Lutta, and remember, you can become a partner with us. It is very simple. It is very important for you to do that. You just go to your paybill number 171133. Account is Oracle TV. It's because of you that you are still on air. And also, there are so many other ways of you partnering, bringing in your adverts, makes us be on air. And if you want to know more about it, our number is still running on your screen as 0711 176 006. When you call the number, we'll be glad to tell you how to go about it, how you can do your advert. Unajua unaweza kuwa unaona advert unasema ya ule inacheza mzuri nataka tu kama hiyo, but that will not work for you. So we'll tell you, we'll advise you what will work better for your company, for your business, how is it going to run, ni nini na nini unahitaji. Maybe you've been on social media, unaambia kila mtu kwa social media mbona yangu iendi. We'll tell you what is going wrong, what are you doing wrong, ni nini unafaa improve on, and how are you supposed to be doing 1, 2, 3 so that your business will boom. You know, at the end of the day, it's you making profit that is important. So call the number that is running on your screen, and we will guide you. We have videographers, we have photographers, we have graphic designers. They will tell you and help you to give you quality advert. Yenye kienda pale nje kila mtu anakuuliza what happened, ni nini ulifanya, and your business will be growing and grow and grow and grow. So keep on calling us, keep on partnering with us, and we will appreciate you so much. Daktari, as you are ending, give us your partnership. Kuna ile maybe swali sijakuuliza na unasikia hii lazima wajue.
And parting shot yangu na antibiotic is not a multi-purpose cleaner.
Wow.
Ukikuja hospitali tujakupea antibiotic, tafadhali shukuru Mungu tujakupea antibiotic. You should be telling God, thank you, I wasn't given an antibiotic today. Most people come to the hospital, and when you're not given an antibiotic, you think that hospital is bad. Hiyo hospitali hata watu wafanyangi kazi, hata sikutritiwa vizuri, hata hakuna dawa niliandikiwa. Imagine nilipewa tu paracetamol na cetirizine, hakuna kitu kingine tulipewa. Saizi ulikuja na homa, keep in mind homa ni viral, lakini you want us to give you an antibiotic. So kindly, antibiotic is not a multi-purpose cleaner. Respect the dosing. Respect the source of the drugs. Make sure where you're buying your drugs is legit. And then respect the professionals.
Wow.
Yes.
Respect the professionals. Hapo, ukiambiwa ni hii njia, wefuata tu hiyo barabara. Trust them. They know why they have told you barabara ni ya right na si ya left. So you trust them on what they are telling you, and trust you. In few hours, in few days, you'll be running like nobody's business. I have this thing in one mandikap I just want to read for you. The right drug in the wrong hands can become poisonous. You know, you can be having the right drug, but it's not in the right hands. So when you have the right drugs, but it is in the wrong hands, it becomes poisonous. And of course, never guess with medicine, your life is too valuable. And of course, this has been the Healthdesk with me, Trevilla Lutta, your direct client, your medical doctor. Until next time, remember, this program has been sponsored fully by Vinova Clinic. Make sure you go there, get checked, fanya vitu mbili tatu, and of course, keep on inviting people pale. Ambia watu wapatikana wapi, waambie twende niliona mahali fulani, and they treat people better. The checkups are good. The employees and the nurses and the workers there are friendly. Make sure ukienda pale, trust him, utatoka na tabasamu. Unaona pia unaendanga unatoka umekasirika hapo, utatoka na tabasamu because of how they will check on you, how they will do the services. Utapenda tawe mwenyewe. So make sure you make hii wiki tafuta tu siku. Saizi kwanza watu wengi wako off jamani. Tafuta tu siku, waambie familia, leo nimeamua hii mwaka tujaenda mahali popote. Let us go get checked. Tuangalie mwili yetu kama iko sawa, tuangalie nini inaenda vibaya kwa mwili, nini tunafaa kuchange. Enda tu usikie daktari anakuambia nini. At least utoke hapo ukiwa na smell. Even if you're traveling, you'll travel knowing how good your health is. And of course, until next time, I've been Trevilla Lutta, your host, your favorite host at this Healthdesk. God bless you.